One of the most common motor disabilities found in childhood is cerebral palsy, or CP for short. CP is a cognitive disorder of movement, muscle tone, or posture. I believe CP should be more known since around 7 million people worldwide have a different type of CP disorder. I'm going to tell you what CP is, spastic CP, and how CP is treated. For starters, let's give some insight into what CP is, or how I like to call it again, CP. So I'm going to refer to it a lot as CP. CP is a disorder of the brain. The brain will tell the body what to do, but it won't do it because a certain part of the brain is infected. The person might not be able to walk, talk, or move the way others can. So some people with CP can walk, but it's very stiff. CP affects muscle tone, ability to coordinate movements, and again, it affects the part that's affected for most people is the motor, like cortex, I think is what it's called. The risk of having CP varies a lot because it depends. So you could have, one of the risks is premature birth. So before 37 weeks or the 32nd week of CP is greater to happen. So my sister was born at 27 weeks. So that's how she got hers. Intensive care units have greatly improved over the years, but there's still a chance of your child developing some kind of medical condition by being born early or tiny. Another risk factor is birth complications. It can start from the detachment of the placenta or even to the umbilical cord wrapped around the neck, cutting off oxygen supply. If your child does develop CP, there are 3 types of CP. The 3 types of CP are spastic, ethetoid, and ataxic. Spastic is one of the most common cases of CP. It can either give you no muscle tone, and it can give you stiffness, and it's caused either before, during, or after the birth. Spastic CP can affect your upper, lower limbs, and your speech. So when you go to reach for something, their arm might shake, or when they go to grab something, their fingers will just stay in a fist. And then if they do use a walker, then their legs will be a lot more stiffer. Over time, the soft tissues can deteriorate and the muscle fibers can change their properties. So to help with spastic CP, a lot of stretches are involved, and if you're not able to stretch, then it can lead to bony structure and deformities. And it also is kind of caused by scoliosis and hip dislocation. The pain with spasticity is persistent, and for some it's aggressive. So medications, kind of like a pump that my little sister has, is hooked to her spinal cord to help her with her hips. Many ways to help and treat CP and spasticity are different for every case. According to kidshealth.org, if you're treating someone with spastic CP, here's the team of healthcare providers you'll need. You'll have to start with a pediatrician, a developmental behavioral pediatrician, an occupational therapist, a physical therapist, a speech therapist, a neurologist, an orthopedic, and many more. That's just a short list for the childhood. It's important that the person knows what is going on as they get older and their treatment options to keep their best interests at heart. The treatment plan overview. You start with physical therapy and occupational therapy that you go to weekly. And you start it when you're young, so even when you can't move, so like a baby, they still do that just with toys to work on your grasping. You then go to leg braces, which are just almost like shin guards, but behind you. Then a walker and a wheelchair, and some of them have all 3. So this is a manual wheelchair. It's her second one. Her other one is a lot tinier, and she has a power wheelchair now, but we use this when we go to bigger crowds where she can't really control the atmosphere around her. Medicine also, so again, her pump, and then some other people have bags with them or kind of like an air thing that they have with them. Nutrition is a big one because some of them might not be able to gain weight or lose the weight. And then hers, she has trouble losing the weight, so we have her on different kinds of things. And then surgery is also a big part. So she's 14, her name's Caroline, 14, and she's had 23 surgeries, 2 including kneecap reconstruction, and then she got her hips moved back into their sockets because they came out. And then she also had another surgery for her pump, and she has to get that done daily. Now you know what CP is, spastic CP, and how CP is treated. I believe more people should know about CP since it is common now. Looking ahead, if you come across someone with CP, they just want to feel involved and treated normally just like we do.